Um, so my name is Jared Kunz, and I'm gonna be doing my final head-to-toe assessment. Um, so I've already done a thorough health history and mental status exam. I've already done vital signs, height, weight. I've already done a Snellen test, during which we tested readability and vision acuity. And we've tested, I need a drink of water, a neurological assessment. First, I'll assess orientation. All right. Can you tell me what we're doing here today?
We are doing an assessment for your class.
Correct. Can you tell me first and last name?
Lexi Reese.
And where are you at right now?
I am in Logan, Utah.
And where?
Jared's house.
That's right. And Logan, Utah. Can you tell me the date?
It is June 30th, 2020.
June 30th, 2020. That's correct. Whew, kind of tired. So next thing is, what are those? Explain what I'm doing. So we're going to be doing a head-to-toe assessment. I'll assess your head, I'll assess your cranial nerves, I'll assess your cerebellum, your balance, cerebellum, balance. I'll assess your head, your eyes, your ears, your nose, your throat. I'll assess your trachea, your thoracic, your abdominal regions, and upper and lower extremities, and I'll assess your reflexes. So cranial nerve 1 is smell. Can you close your eyes for me? I plug one nostril. Alright, can you tell me what that smell is?
Garlic.
Correct. Alright, plug the other nostril. Can you tell me what that smell?
Cinnamon.
Correct. Okay, you can open up your eyes. Cranial nerve 1 is intact. Cranial nerve 2 is vision. Snellen test is already done. Cranial nerves 3, 4, and 6 are the pupils. Have to do with the pupils, the eyelids, and the ways the eyes can move. Close your eyes. Open them. That's good. Alright, I'll do cardinal movements. Follow my pen. Don't move your head. Just follow with your eyes. Alright, that's good. We will assess for Perla. Make sure the pupils are equal and reactive to light and accommodation. Sometimes it helps to dim the light, and so look straight forward. So I'm assessing for pupillary response. Yeah, that's good. Check for accommodation. So look straight forward. And don't move your head. Alright, and they accommodate. That's good. Cranial nerves 3, 4, and 6 are all intact. Cranial nerves 5 and 7 are next. That has everything to do with the face. So scrunch up your face. Alright, smile. Puff out your cheeks. Alright, close your eyes. And tell me if you can feel this.
Yes.
Can you feel that?
Yes.
Can you feel that?
Yes.
Can you feel that?
Yes.
Can you feel this?
Yes.
Feel it?
Yes.
Can you feel that?
Yes.
Can you feel that?
Yes.
Perfect. Cranial nerve. Oh, actually, do one more thing. Ooh. I could also assess for sharp or dull. I don't have something really good to assess with that at the moment. So that's something else I could also assess for. Next, C5, I did 5 and 7. Cranial nerve 8 is hearing. So I don't have the instruments to assess that. But if I did have a tuning fork, I could strike it and put it on the top of her head midline and ask which is louder, the left or right side. I could strike it, put it on the mastoid process, and move it next to her ear and ask which is louder, conduction or air, and then strike it again, do another mastoid process, put it next to the ear, and ask which is louder, conduction or air. I could also whisper a word in each ear, and she could repeat it out loud to tell me if she hears it or not. In my case, I'll do a few words. John Kelly is.
Yes.
Say it out loud.
John Kelly is
A really nice instructor.
a really nice instructor.
That's right. Alright, cranial nerve 8 appears to be intact. Cranial nerves 9, 10, and 12 Our tongue movements. All right, stick out your tongue. Roll up towards your nose. Um, towards your nose. Push your tongue against each cheek. Other cheek. Do the side again. Okay, that's good. And that's good. Okay. Open up your mouth. So if I had a tongue depressor, I'd stick it in. You can also use my flashlight, see there a little better. Tilt your head back. I would push down your tongue, say ah. I would assess the teeth, the tongue, the mucous membranes, the tonsils. I can also poke the back and stimulate the gag reflex, but I won't do that. I don't have a tongue depressor, otherwise I would have inserted it in there. I could assess swallowing, so this is water. So take a sip of water. Okay, take another sip. All right, I'm looking at the trachea. I'm noting the thyroid. Okay, I'll take this back. Thanks. I could check the lymph nodes, so I could feel under the jaw, under the chin, front of the ear, behind the ear, suboccipital. I could feel anterior chain, posterior chain, supraclinic duct. Okay, and those are all good. I could also assess the head, looking at for any lumps, bumps, or bruises. I could look at hair distribution. I could look for any scalp issues. I could look for assess the texture, warmth, and color of the skin. And I could do a sinus assessment. So tell me if you feel any pain or tenderness when I push here.
No.
All right, what about here?
No.
What about here?
No.
Okay. And that's all good. Cranial nerves 9, 10, and 12 are intact. Cranial nerve 11. Strength of the shoulders and neck muscles. Alright, shrug. Okay, turn your head, look to one side. Push against my hand. Okay, turn your head to the other side. Same thing. Can you dismiss that?
Sorry.
That's okay. Alright. All cranial nerves are intact. Cerebellum balance is next. Alright, with your palms, can you go like this? Alright, one side at a time. Other side. That's good. Touch fingers to thumb. Okay, that's good. Alright, stand up. It's kind of hard to see, so we're going to bend the camera down. See your feet. Alright, so try standing on one leg. Other leg. Slide your heel against your shin. Other one. Alright. So now we're going to do it again with your eyes closed. I'm going to put my arms next to her. You can't see it as well. So to help prevent her from falling. So close your eyes. Alright, now do it all again. Okay. Other leg. Slide heel against each shin. Okay, that's good. So now keep your eyes closed. Alright, put your arms straight out. Up like this. Now, one at a time, touch one finger to your nose. Okay, other one. Alright, that's good. You can open your eyes. And you can sit back down. Okay, graphesthesia, gastrtia, stereognosis. Close your eyes. A familiar object. I'm going to place a familiar object in her hand. Tell me what that is.
A pen.
Correct. Alright, I'm going to draw something on your hand. Keep your eyes closed. Tell me what it is.
The letter B.
Correct. I'll have you stand up again. I assessed her gait when she walked in. Now I'm going to do a more thorough assessment. Alright, so step on your heels, like this. Okay, step on your tippy toes. Okay, now do heel to toe like this. Walk towards this towel. Alright, the camera up. Step back in. Tilt this camera up. So do that one more time. Alright, and now that is a scoliosis assessment. Okay, so now I'm going to check for tenderness, stand right there, of the vertebrae. Does that feel tender at all?
No.
Alright, so I'm going to check for CVAPN, that's kidney pain. Does that hurt?
No.
Does that hurt?
No.
Okay, you can sit back down. Alright, so Please clench your jaw. I'm going to fill the TMJ joint. I'm going to fill the mastoid. If I had my instrument, I could assess the outer surface of the ear, noting any pains, growths, anything abnormal with your skin. I could assess the eardrum, shining it in there. It should be purely gray. It should be white. I should be able to see my light reflect off of it. Using my instrument, I could also assess in each nair, noting the color, the turbinates, assessing for a deviated septum. Color of the turbinates, assessing for a deviated septum. I think. What was the next thing I was going to assess for? Snare, the color of the turbinates, assessing for a deviated septum. Assess the jaw. Assess trachea. Skip that for now. If I remember it later, I'll come back. So, next thing I'll do is lungs. Okay, so we're going to assess your lungs. So I would do this front and back. The voice transmission test. So you have to listen where the lungs kind of flow. So follow the lungs. So you do this side and then lateral, and then the other side and then lateral. Then do the same starting up high, and follow the course of the back. Listening for bronchial, bronchial vesicular, and vesicular. And so I'll have her perform that, and we'll just do it on the back. The voice transmission test. Let's go. I have headphones on. Okay, so I would normally wear them, but what's this over here? Okay, so can you say E?
E.
And then I would do that again all over. And then can you say, I then can do a gophony. Can you say 99?
99.
Say whisper 1, 2, 3.
Whisper 1, 2, 3.
Alright, and that should not be clear. If it is clear, we have consolidation. Try to slide that off. Okay. It's clear, we have consolidation. Lungs. Mentally reviewing, making sure I covered everything there that I wanted to cover. G. Next is heart. So I'll assess the heart. I guess I could, everything like this, I would probably still record okay. Put on my stethoscope. Yeah, it's not working on this microphone. I'm going to go back to what I was doing before. Alright, so I'd actually be wearing these, not wearing them like this. So I'll assess her heart sounds. I'll do, see it's on the right side. So right side for you is this side. So I do aortic, which is in the second intercostal space. Pulmonic is on the left side. Erb's point is the third intercostal space. And then tricuspid is the fourth intercostal space. Then mitral is fifth intercostal space. On the left side, midclavicular line. And you'd listen for a full minute. And with women, you may have to have them lift their breast in order to be able to hear it. Heart sounds. So next I'd assess reflexes. So I would have her remove her jacket for this, but I'll just have her keep it on. So relax your arm. So if I had my instrument, I would tap it right here for that reflex. And then relax your arm. I'll bend this camera down. Then I would do the bicep, tap right there. And then I would do the one on the wrist, tap right, as you can see right here. Then I would do bend it down more. I would do the knee region, so I'd tap right here with my instrument. Then I would tap the back of the ankle right here, and that would be the Achilles. Then I would push against the heel, and this is assessing for DVTs, so noting any pain. And as I let go, if it flaps, that's clonus, and I need to let the provider know. And I would assess the reflexes and for clonus on all the extremities. Okay, stand back up. Stand up a little more. Reflexes and clonus on all the extremities. So, strength. Next thing I'll assess is strength. So I'm going to assess for cap refill real fast. Oh, I need to also check for pulses. That's what I forgot. So I would check the radial pulses. I would check behind the knees. Hopefully I'm not giving you vertigo by moving up and down so much. I check behind the knees. I check the tibial. And then I check the pedal pulses. I'd also check for cap refill on each of the extremities. Okay. Oh, that's hard. Thanks, back up. So, strength. Strength is the next thing. So with my hands on your arms, try to lift your arms up like this.
Like this?
Like this.
Oh, like this.
I'm checking out both at the same time. Ready? Alright. That's good. Try to squeeze my fingers. Okay, that's good. Alright. Try to push up with your knees. Yep. Try to push out with your shins. Alright. And try to lift up with your feet. Alright, that's good. All strength is good. Strength. Cap refill. Trying to mental review. See if there's anything else I need to do before I have her move on to thoracic. So I've already done my thoracic assessment. Do the final part, so I'll have you lay on the ground. So I'd want to do this while she is supine, assessing the thoracic and abdominal. I'll bend my camera down so you can see us.
Should I have my legs straighter?
Yeah, straighten. Can you straighten your legs comfortably? Is that comfortable?
Okay.
Okay. So ideally I'd have a better spacier environment for this kind of assessment, but I'll do it with the space that I have. So first I'd have her remove her jacket. I would just inspect. I'm looking for any pulsating or any masses, and there shouldn't be any. It should be soft, it should be flat. Then I would do, should be soft, it should be flat. So I would first listen. So I'd take my stethoscope, I would listen in each quadrant, and I'm listening for any sort of clicking, bowel sounds. For time I'm going to go a little faster, but if I was bowel sounds. If I didn't hear bowel sounds, I would listen for a full 5 minutes in each quadrant. Then I would listen to the aorta here. And then I would percuss, and I'm just doing a sort of tapping. And this is an advanced skill. And I'm listening for any sort of noting hollow organs, spaces. And then I would light palpate, and I'd let the patient know. I'm going to palpate. If you feel any tenderness or pain, let me know. And I'd palpate all 9 regions. And if there was any sort of pain, then we would not deep palpate. Then I would assess the liver and the spleen, the margins. So I'd first have you empty your bladder, then have you take a deep breath and breathe out. And I would fill the liver. And then take a deep breath in, breathe out. And and I'd fill your spleen. And if for whatever reason the spleen or liver is enlarged, then I would need to be cognizant of that. And that is my head to toe assessment.